Hi, it's time for good energy, and I'm Dr. Julie. Welcome to Bodyful Day 155, rib pain and the senses, and we are on day 2. We are talking about the sense of smell. Let's go ahead and start with the basics. Take a deep breath in and release. Go ahead, we're going to take a deep breath in, expand the belly, expand the chest, expand into the sinuses, and tuck that tailbone. Deep breath in and release. And now think about any place that you've been storing energy that's a little bit of angry. Maybe you feel it kind of spinning in a spot because it's kind of locked there because of stress or anxiety, or the Iowa DOT driving their truck past while you're trying to do a live video, anything like that. Go ahead and take a deep breath in and release. All right, today is day 2 of rib pain and the senses, and today we're talking about the sense of smell. Now we're going to cheat a little bit. We're going to do sense of smell and kind of backtrack into touch. We talked about gate theory when we were talking about rib pain and touch yesterday. We talked about points on the front that you could rub that would help take care of pain in the back if that's where your rib pain is. Today we're going to talk about the sense of smell, and as I said, hijack touch. But smell, you might think, well, yes, I'm going to breathe in, but how does what I breathe in affect pain back here? What does it do? I don't get it. Well, remember that we're working from the healing equation. So energy to heal or to reduce that rib pain equals good energy and minus stressors. And so our goal is to come out positive in the end. So it really doesn't matter what shape or form the sense our good energy in takes the form of. As long as it is more than our stressors, we're going to have positive good energy in, and that should help our body try to resolve what is causing that shoulder stress or that rib pain, but also increase our ability, decrease our overall sense of pain because we're bringing good energy in, and that can dampen the pain sensation. So what do we know about the sense of smell? Sense of smell activates the brain. The brain then activates memories. Those memories can do the top-down fiddle bit. We've talked about that last week with stress and the senses, but this is a top-down fiddle bit where the top-down component is, of course, your past memories that are good. So you could look at things that you have around the house. You could look at herbs and spices, candles. There are whole industries based on the idea that if you produce a scent, the top-down information comes in and you feel better. But there are other things that we can do. We can add scents that are designed, or scents that have essential oils that have science, a little bit of science behind them, that suggests that these scents can reduce pain. So essential oils for pain and muscle strain include things like ginger essential oil. When you smell ginger essential oil, it has a tendency to reduce pain. Frankincense is also one of these. Fir needle is a really fantastic one because fir needle is actually both reducing joint pain but also respiratory pain. So if your rib is out, not just because you picked up something too heavy, but your rib is out because of some underlying condition in your lungs, then inhaling fir needle was actually going to benefit both that underlying condition and your rib pain. We can also use peppermint in the same way. Peppermint is good for pain. Anytime you have pain, you can put a dab of or dilution of peppermint oil on that pain spot, and in the inhalation of it will also reduce your effective pain because it's giving you good energy in, but it's also respiratory oriented. So if there's a respiratory component to your rib pain, that will help it. Turmeric, overall good for pain. Smelling turmeric is kind of like smelling a little bit of mustard, a little bit of pickle. Turmeric oil is not one of the most popular things to have around, but it does exist. And the last one, which is also good for respiratory and overall pain, is black pepper. Now, any of these, turmeric, black pepper, peppermint, fir needle, frankincense, ginger can also be put in a dilution and put on the rib that's causing pain. Or, so we talked about the opposite. We talked about the opposite being the front of the chest. And you could, if you could find the front of the chest where connected to that rib and back that hurts, you could put a little bit of diluted oil, dilution of oil, diluted oil? It's the same. It's not sane. A little bit of a dilution of an essential oil on the front as well, and that would help the back. So you have a number of routes to calm rib pain through your sense of smell or through things that are designed to both do sense of smell and go into the skin and provide a little bit of relief. All right, so just as a reminder, the big 6 in terms of lung pain or rib pain and respiratory are ginger, frankincense, fir needle, peppermint, turmeric, and black pepper. Those 6, depending upon if one of those really just feels good to you or that you like the sound of, are really good to smell to reduce pain, both the pain of a rib and the pain of the chest or pain in the lungs, as well as put on to help with joint pain and also reduce possible rib or lung stuff going on close to the edge of the body. All right, let's finish this off. Take a deep breath in and release. A really quick note. One of those 6 is going to probably make you breathe better. Now, has nothing to do with pain or lung capacity. It has nothing to do with the pain in your rib or the lung capacity. What it does is it's relaxing your nervous system. So we go back and we say, well, what is going to relax you the most? That's going to give you good energy in and help you take care of your stressors. So do the smell test. Smell some ginger, smell some frankincense, smell some fir needle, smell some peppermint, smell some turmeric if you have it, smell some black pepper oil, and whichever allows you to take the biggest breath in is going to be the one that's probably the best for your rib pain. All right, have a great day. I will see you tomorrow. Take care.